Hi guys, how you doing? It's me. Anything new? Good? Bad? I had some not good news last week. I have started this video 4 or 5 times now because it's not coming out right. It's not. I'm okay. I'm okay. It's not that there's, been some crazy update or something. But I did get a call last Thursday, and that call let me know that my doctor of 43 years, I'm 51, I've seen him since I was 8, I can do math, right? He's retiring out of nowhere. Okay, so I panic. That's that's what I do. I panic. And I just, geez, what the hell do you do? You find out, like, basically, your doctor's going out of business. And I have one doctor, one who handles all of my shit. He does my disease, my Ehlers-Danlos. He does my cholesterol, my psych, my everything. He's my doctor. Was my doctor. I called the insurance company, like I said, and I was lucky enough. I have my fan on again. I'm sorry. Get the little flyaways. Excuse me. So I get the insurance company, and I had a very nice lady who just takes pity on me and says, "Ma'am, you need to get to your doctor and get your file, your chart." And why? She goes, "Well, if he closes his doors and you don't have it, you ain't getting it." And I went through the whole spiel. I'm sick, same doctor, So she at least got me on a path. And I said, if my doctor, who prescribes everything for me, can no longer prescribe a few medications I take, what do I do? What should I consider? Where do I need to go? And she told me that basically what I needed to do was find a new PCP, and then they would guide me from there. So I found a PCP who took mercy on me, complete mercy on me, and saw me the next day, the very next day. And I went in, I told her what I have and what's wrong with me. She didn't know. Nobody knows about this fucking disease. I guess it's why I talk about it, or why I bother. Okay, so she hadn't heard of it. So here I am again with a doctor who hasn't even heard of my condition. Like, how comforting is that to you? So she gets all my prescriptions and my medical history. She was phenomenal. She was fantastic. She took like a good hour with me, which was cool. She did not have to do that. She didn't have to do anything. So we get through it, and she says, "Okay, I see here." And she goes, "I see you have your normal medications, your illness-related medications, and your psych-related medications." She goes, "I will help you with everything till we get anything together." She says, "You're going to need a pain management specialist, a rheumatologist, a cardiologist, a phlebotomist, a blood doctor, one of them, and I want an orthopedist, but supposedly the rheumatologist can do the orthopedist thing for me." And I don't know what you do know or what you don't know about Ehlers-Danlos syndrome. I'm hypermobile. My joints are super flexible, and what that did over time, by the time I was 25, was wear them out. So all of my ball and socket joints, my knees, my hips, my shoulders were starting to disintegrate by the age of 25. And it presented as my doctor was calling it osteoarthritis, because they're very similar, I guess. And we just, he watched my bones were disintegrating. So the new doctor saw me. She didn't know what it was. She was kind enough let me tell you, I saw her very early in the morning, like 9 in the morning. She called me by 4 p.m. to let me know she had looked into my disease. I thought that was so awesome, you know? And she's, like she said, she just wanted to get me on an efficient, effective, you know, plan that's going to meet my needs. So we started discussing referrals, and apparently, like I said, I got 50 doctors now, half of which I saw this week. I did, but oh my God, oh my, this one test I have, I'm going to tell you this, because I don't know who I'm going to tell. I don't know if I'm going to tell the doctor or the insurance company, but like some shit went down, okay? I'm having an echocardiogram. If you don't know what that is, excuse me, it's basically an ultrasound of your heart, okay? Ultrasound of your heart. So, you don't have anything, you know, you're kind of a little naked. But, you know, as a woman, they try to cover you on each side, but you're exposed. You know, the woman's doing I had a lady, tech, who's doing my echo in a darker room, and another lady comes in, says, mind if you use my computer? My daughter and I look at each other and we're like, you know what? It's a new game. It's a new day. I have to do this shit. We're good. We'll deal with it. So there I am. Now, your heart leans to your left side. So for this echo, I was as left as I can lay. I can only lay like really flat on my back. But so she tried to lay me as left as she could. And I don't know how to say this tactfully. I'm just going to say it. Basically, when they're doing it, no matter how covered you are, your left breast is exposed. You know, they have the paper gown on it, but because they're doing the ultrasound and coming up under that, you know, you're fairly exposed. And I'm chunky. My tits are huge. They're huge. I hate them. So I'm sitting there now. Now there's a lady in there. My boobs hanging out. My daughter and I are looking at each other. I'm getting echo done, which is not the most fun thing. The lady starts vaping. I shit you not. The lady at the computer that shouldn't have even been in the room, my daughter tells me this. I can't see the full angle, okay? The lady sits down. She pulls out her mask from the bottom, puts her jewel in her mouth, takes a hit, flicks her eyes back at my screen that's doing my echo, because again, it's like an ultrasound, so you still have the television monitor. Bitch turns around, looks at my screen, which means she saw my left just hang in there. It's very embarrassing. I don't know who to call. I don't know, but I just don't think that was appropriate. And let me tell you, if I had a mom, or that was my mom, and some bitch pulled that, I probably knocked her out. She's probably a very lucky lady, because my daughter was not happy. She's still not happy. It's a shame for them too, because starting out with the echo is one thing, but I get yearly scans of at least, I want to say 12 to 14 joints now, and they're a lot of money. And I don't know if I'm going back there. Maybe that's what I should tell them when I call, because I don't like to bitch shit people. I don't, especially in any kind of, I don't want to say retail, but any kind of transactional customer service. I know it blows. I know it does. And I know there's people out there that will like wreck your fucking day. But I was having something medical done. My boobs hanging out. And this bitch is jeweling 6 feet away from me. You know, I am a former smoker. I'm a former vapor. I am very weak when it comes to nicotine. Like, I smoked from the time I was 11 or 12 until I was about, I think I was 46 or 47. And I've had, you know, a lot of shit in my life. I had a lot of shit. Losing my doctor isn't good for me. He, even the mentals, you know, because like, when you know somebody over a certain period of time, you get like, you joke a little, or you laugh, or, he would, we'd make a joke about my medication, about, the psych end. And he'd say something to me, and I would say, like, to him, I'd be like, hey, it's not like I'm psychotic, I just get a little neurotic, you know what I mean? But when he's writing that in his chart, you don't think that anybody else is going to see that chart any day. And wow. So we picked up my chart, and I only got to flip through it as my daughter was driving me to the new doctor, but he had some quotes in there. And that's fine even. I don't like being ill. I don't like being ill, and now I'm surrounding myself with like new people, and I don't even like them. I don't like anybody except the PCP that I've dealt with yet. And I will be dealing with these people on a repeat basis. I don't know what to do. I don't. I'm so lost. And I know that sounds stupid. Maybe you can change doctors like pancakes or waffles, or, you know? I can't. You know, even when I lived down the shore. I lived about 100 miles away from my area where I grew up. Moved down shore. Damn it, when I was sick, or you know, if I had strep throat, or I needed my doctor, whatever, I came all the way up here to see him. Because he's my doctor. And apparently, not my doctor anymore, and I just didn't get any notice. And again, my mother passed away when she was 50. I think I was under 30, and my dad, he was killed when I was 3. So I'm probably a walking abandonment issue, I would think. Just like it shouldn't affect me, I think, that my doctor's gone away. Terminally ill or not, maybe you shouldn't be that attached to your doctor. I don't know. Now, medication-wise, it's really difficult. He gave me no notice whatsoever. And I've recorded this so many times, I don't even know if I'm repeating myself or not. Like what I take, like for my arthritis, like I take Celebrex and prednisone, that's a steroid. I take gabapentin for nerve damage. I'm on 2 different muscle relaxers for, you know, spasms and issues that I get with the central nervous system with my Ehlers-Danlos. And of course, there is a narcotic pain reliever in there, and my psych meds. Gone. And let's take the psych meds. Let's take those, okay? It took me probably a good 11 to 14 years to get like my, what I call cocktail together. What it is I need to take to function as best as I can with, you know, whatever issues I face. I'm very OCD. I am bipolar 2. I deal with a lot of depression and anxiety, generalized anxiety. Like, yeah, it's all kind of irrelevant. It all kinds of fits in with my life. It makes sense. But it's between me and my doctor, not me and a stranger doctor person. And another thing I'm very concerned about is which doctors might want to change what. You know, if I know something's working or something's not, or they say, you know, oh, you take this for arthritis? Well, we have this. I don't want to start fucking around. I'm 51. I've been sick since I was 25 or 26, and I was diagnosed 4 years ago. I don't want new meds. I don't want new doctors. I don't want new tests. I know life's a bitch and all, but like, I expected some kind of notice. I did. As I understand it, I'm one of the lucky ones that got a call from him. And again, I would tell you again, but I think I've said it at least 6 times now. My maternal grandmother was one of his very first patients back in 1976 when he graduated. And then, so my mom started going to him, and then I did. My kids do. Now if they want to continue for the next, I don't know how long, they can do that. But as a mother, I don't want them to go through what I'm going through. I'm not going to put them on that trajectory. So maybe it's just better to change their doctor now before they get attached or have things that can't be scripted or any issues. I don't know. babbling, and I'm sorry. Otherwise, I'd be crying. And it's not good. It's not good. And the bitch of a rheumatologist. Oh my God, she's rotten. And she just, don't like her. But maybe I could find a new one, because there seems to be a new one at everything. But apparently what my doctor was covering was the work of 4 or 5 different doctors that I now have to find and jump through a lot of hoops through to keep any medicinal regime, physical therapy regimes, equipment, anything I need. It's just, I feel like it's just all been pulled away. I'm so sorry. Doctors do this. I get it. I'm sick. I thought this would be the doctor to see me out. I did. My life expectancy ended 3 years ago. So, yeah, I knew I'd be good with him. It was like, who's gonna go out first? The sick girl or the old doctor, right? And, it looks like it's the old doctor. And again, supposedly, I'm so lucky I got this phone call. And I'm just devastated. I really am. This is like huge. And I've had shit happen in life. I've had some bad shit happen. If you had handed me a list last week and said, okay, what are the 5 things we can fuck up in your life? Like, my doctor would have been the last, I think. Once a month. I mean, I see the man that often. I have to. I'm sick. I have a rheumatologist that's arguing with me. I'm not even kidding. Did I tell you already? Was that the first recording, the 5th recording? I don't know. But this woman is on a mission to prove to me I do not have exactly what I have. And even on the test she wrote, when doctors write your tests, they write rule out this or rule out that. Well, instead of writing rule out Ehlers-Danlos, she actually wrote, I believe you have benign hypermobility and severe osteoarthritis. Wrote that. A doctor, use the word I believe. Not a diagnosis code, none of that shit. She was just pissed. I walked in there thinking I knew what I had, because my doctor and I have been doing this. So she wrote the benign hypermobility and the severe osteoarthritis. And again, you don't present with that when you're as young as I was. Now, by the grace of God, all the other doctors have been great. As great as they can be, accommodating, whatever you want to call it. They've all tried to work with me as quickly as possible, because I see that today, like, you could not get a doctor's appointment, a shrink's appointment, anything appointment without, one of them was 4 months off. They're going to call me back. They took all my shit, and they're going to call me back when they can get around to seeing me. How fucking nice. But I got spoiled with a doctor that, I had his personal number. I could call him. Or, if I called the office, they'd see me that day. And that was a luxury. And I always very much appreciated that. I did. I never took anything for granted with my doctor, other than I thought I'd beat him out. Nope. So, aside from that, I'm sure there's other stuff that's new. I know there is, but I'm just so over it that, I don't know right now. I don't know. And my son bought me, I have at least 3 or 4 palettes to review, all kinds of makeup. He was always looking at that for me, my daughter too, and it's just been hell. It's been hell this week. And if I wasn't trying to get to a doctor or back or over that to get to the new one, next one, the next day, it just, oh, it's brutal. It's been really, really bad. I'm sorry. So I don't know. I'm going to call this a health update, doctor's update. Certainly not a makeup review. Certainly not as happy as I'd like to be. But I guess, you know, it doesn't matter when you're sick or how sick you are or what it is. You know, doctors are people too. And I guess they gotta retire sometimes. I don't know. I'm so close to the city, you know, I swear I should just, I don't know. I don't know what to do anymore. I'm beside myself. My poor daughter this week, she drove me to all these appointments and all this shit I'm bitching about. Brought me to everything. She did. God bless her soul. Didn't bitch once. And even when the lady's like, lay on your left side, my daughter jumped. She can't do that. She doesn't lay on her side. She's very protective. And it's refreshing for me. I really never had somebody that was like, just like wanting to like protect me or whatever. It was pretty cool. It was nice. But, yeah. See, my doctor would have known I can't lay on my left side because he was my doctor. I guess this is it. It's real. And I have a call coming back, I believe, Tuesday. Because, again, I was supposed to fill this Friday, yesterday, the other day, Friday. And, because for whatever reason, I have enough medication till Tuesday, and the PCP I'm seeing, she's not too quick to want to write, unfortunately, 2 of the things I take, and I understand that completely, you know, but we thought I'd be in with the pain manager by now, so I believe she's gonna call me Tuesday and see if we can at least maintain the pain regimen, because I think I have everything else. Like, you know how you don't always take your medicine every day, or something says take it 4 times a day. If it's not an antibiotic, you got to take those. But if it says like, oh, take 4 times a day for pain, and you don't hurt that bad, so you take 2. You know, you get some left over, and so then you have some left over, and you don't have to like panic on the exact day. But that's, you know, it only lasts so long. So yeah, I guess I just came on to bitch about the fact that my doctor is going away, or retiring rather, sorry, and it just shouldn't be a second thought probably to most people. But when you're in the middle of being sick, it's not fun. And I still haven't talked to him yet. I only talked to his like highest secretary, because if I talk to him, I really think I'm gonna cry. I know I'm gonna. I have been. I'm doing my best not to do it now, because like even in public, I have this thing about like being what could be interpreted as weak. I walk straight. I stand straight. Like if you saw me in public, you would have no idea. Unless I have like a cane or some shit like that, or wearing one of my braces or whatever it is that day. I go out of my way to look, stand, sit, whatever, normal, straight. You know, I'm broken, because I am. No, and I have this thing about being in public, and it's not even looking healthy, just looking normal. Not limping. You know, if I see something that I want, I know that I can't grab it because it's, you know, higher than my chin or whatever, I'll ask my daughter. I'm very defensive about what I'll show in public, and I think I'm gonna need to get over that sooner than later, because I have some progression. I have very serious progression in all of the joints and the hips, shoulders, the knees, the wrists, the elbows, the fucking ankles. You name it. My jaw, my fucking jaw. So one of them. It's actually dislocated today, and I put extra makeup on it to look even. It's all your joints, and it's my disease. And I fight that. I fight that very hard. But, I mean, my doctor, he's just gonna be gone. So I guess that's it. I should stop bitching about the same thing. I'm so sorry. I really, really am. I'm just a little beside myself, I guess. And it's been, 7-10 days now. But because I've been so busy, I just really haven't had time to, I guess, let it sink in. I don't even think I'm going to have the same friggin' hospital. This sucks. It does. I mean, I've been going to the same radiology place, the same everything since I started presenting when I was 25. That's half my life. God, that's longer than I've had my kids. Gone. But I'll figure it out. I always do, and I'm gonna be fine, because I always am. I just needed to, I guess, get it off my chest, because I have my kids. You know, I don't have any other branches on the family tree. It's just me and my kids, and I hate to, like, bitch at them or worry them or whatever. But, like, I feel like I need help. Or even the insurance lady. I didn't know. I had no clue what to do. I'd have thought the doctor's office might have told me more, but hey, you know. And, you know, the funny part is, the girls, when I say the girls, his secretaries and his receptionists, not only are they all younger, they're so much younger that they aren't the age. How do I explain? I've been going to him longer than those girls have even been alive. Yeah. One of the girls is 30, I think. So she's just sliding in there on the, 20, if I was 8, I'm 51 now, 43 years, yep. There is nobody on his staff older than 40, well, except for him. So yeah, so I'm older than the help. I've been through 3 different rounds of help, but when I started going to him, he only had one. He had one secretary, receptionist, nurse lady, and now he has 6 of them. So he grew himself a good business, and what a good doctor. What a heart. What a heart. I mean, this doctor, used to see my friends. I'd call, I'd say, look, you know, my friend has an ear infection, he doesn't have any money. Can you see him? And he would just do it. He's just such a good man. And, you know, I think that's what medicine should be too. I don't think it just should be, oh, we have this war on opioids and everybody's gonna suffer it, because fuck you. Those medicines, you know, there are people out here, and we may not all look it, but not all of us are well. We're not. What do they call it? The invisible diseases, right? Yeah. And again, if you want to or care to or whatever, the Ehlers-Danlos, you'll find it is one of, by far, the most painful diseases there is. You know, so I'm so sorry. I'm gonna get myself together and breathe. And I would love to hang out and bullshit with you, but like, I just completely fucking drained myself, and you too, because I may erase this, because I feel like I just droned on about nothing. I don't know. I hope that you are doing a fuck of a lot better than this gal. So, yeah, that's it. That's what I've been doing, and I hope you haven't. I hope you are healthy and well, and that all your loves are healthy and well. And hopefully I will be back before my IPSC, because like I said, I have a bunch of makeup. My son's been buying me makeup left and right to review. You know, I haven't had the chance, and life's upside down. I'm absolutely heartsick. So have a good everything, and hopefully I will talk to you soon, okay? Bye. The clicker's not working. It's supposed to turn this video off. I'm gonna say bye again and smile. And if it doesn't work, then I'll turn it off manually. Ready? Bye.